This study investigated the effect of the MOTIS learning program, which is a social and emotional learning intervention. Social and emotional learning workshops are a promising approach for fostering effective cognitive, academic, and behavioral skills among children and adolescents. However, few studies have focused on the psychological outcomes of SEL programs, for example, emotion regulation and well-being. Emotion regulation relates to our ability to reduce the intensity and frequency of emotions while also generating and sustaining emotions. Unhealthy emotion regulation is a transdiagnostic core factor underlying psychopathology. A systematic review indicated that not only can interventions enhance emotion regulation in youth, but that these improvements correlate with improvements in psychopathology. This study aims to investigate if an SEL program, MOTIS, improves levels of emotion regulation and well-being in a pre-adolescent Irish population. The MOTIS program was delivered in 3 two-hour lessons across a 2-week period. The first lesson taught emotional identification, the second taught emotion regulation in the 5 ways of well-being, while the final lesson focused on empathy, social skills, active listening, and compassion. The study had 150 participants, both male and female. They were aged between 10 to 13 years and were recruited from 8 Irish primary schools. The study used a pre and post design. Measures used include the Sterling Child Wellbeing Scale, which had 2 subscales, positive outlook and positive emotional state. The Emotion Regulation Questionnaire for Children and Adolescents was also used. This had 2 subscales, cognitive reappraisal and suppression. The study achieved 68% power. The results of the study indicated that the MOTIS intervention had a small but significant effect on cognitive reappraisal, suppression, positive outlook, and positive emotional state. Age and gender did not affect pre, post, or change scores for emotion regulation or well-being. However, lower emotion regulation and well-being baseline scores correlated with a greater magnitude of change in post-intervention capabilities. Conclusions. The results of this study support the findings of Moultrich's meta-analysis that interventions specifically targeting emotion regulation in youth increase emotion regulation. The most improved targeted program outcome of this study was suppression. Considering that this is an unhealthy emotion regulation strategy, future research at MOTIS should investigate the possible improvement of negative indicators of well-being. Results of this study also indicated the possible presence of a ceiling effect for individuals who had higher pre-existing capabilities of emotion regulation and well-being. Considering this, future research should implement indicated programs. The limitations of this study included the desired 80% power not being achieved, only self-report measures being used, and only one post-intervention time point being implemented. Implications. The MOTIS program had significant effects on emotion regulation and well-being in this sample of 10 to 13-year-olds. If social and emotional learning programs are implemented during this period, before mental health issues may arise in adolescence, they could support the prevention of future psychopathology and increase well-being. Our guidelines for future research align with Derlich and colleagues who suggest that public policy needs to acknowledge the growing evidence for social and emotional learning programs and begin to incorporate them into the standardised schooling curriculum in Ireland. Thanks so much for listening. If anyone has any questions, feel free to email me on jadeo'rourke24@gmail.com.